It's time now for Medical Moments with Covenant Healthcare. February is Heart Month, so today we are talking about heart health in women. Joining us this morning is Dr. Mayar Jandi. Thank you so much for being here with us.
Thank you for having me.
So it's very important that we talk about this, especially in February. Do you want to tell us why?
So heart diseases in women, they present differently. We always would like the people to know about them in order to avoid delay of the presentation. So women tend to have different symptoms when they have heart attacks. They tend not to have the typical symptoms people think about of chest pain. They might be fatigued, they might have dizziness, they might have ache in the upper extremities, and those could be the reasons for the heart attack or the signs of heart attacks. So women tend to delay presentations when they go to the hospital. We delay the presentation, that means delay treatment, and hence we have more complication of heart attacks, and that includes more cardiogenic shock and more death in women with heart diseases. So that's the reason we concentrate on those symptoms, and we would like the people to be aware of those symptoms for not delayed presentation to the hospital.
So I want to talk about some of those warning signs. I mean, you might just have a little pain. How do you know when it's enough or when you should go to the doctor?
So anytime there is a change in health with those symptoms, women should take it seriously. Most of the times it is probably not related to heart diseases, but if there is something, we shouldn't delay it, because time counts when there's a heart attack.
It does.
It does, yes.
And so high blood pressure is also one of those things to watch for.
Yes, so high blood pressure considered risk factors for heart diseases. And statistically speaking, women tend to have more high blood pressure compared to men above age 40. And unfortunately, with high blood pressure, there are no symptoms. So if you don't check your blood pressure regularly, you don't know if you have high blood pressure. Treatment should be as aggressive as we do it in men, but women should be aware that the early presentation of hypertension or high blood pressure in them. And high blood pressure is one of the major risk factors for heart diseases and strokes in women.
So you'll want to make sure that you're monitoring that. And
exactly.
Especially over the age of 40.
Absolutely, absolutely. And following the guidelines when we go to treatment.
And that's just one of the things that we can do to prevent this from happening to us. So do you want to talk about some of the other things we can do?
So for the same risk factors for heart diseases in men and women are the same: high blood pressure, treating diabetes if we have diabetes, high cholesterol, stop smoking, being more active. Those things should be done in women. And also women have significant risk factors that don't exist in men, such as postmenopausal in women. Women who are on hormonal treatment, they tend to have more heart attacks. And there is a special category of heart diseases in pregnant women, like heart failures in pregnant women. That's it's not that common, but it's 1 in 1,000 to 1 in 4,000 in the United States. They can have heart failure. Women tend to have a special type of heart failure more than men. It's called diastolic heart failure. So we have to be more aggressive and more aware of treating those diseases in women, and not just the heart attacks.
Yeah, this is so important to know.
Exactly,
What makes you so passionate about, going to work every day?
So I deal with heart failure patients a lot, and I see a lot of women with delayed presentation. Either they survived heart attacks and now they are heart failure patients, and it's something we say, oh, I wish we were aware of this before, the outcome would have been different.
Well, I'm glad that you're here with us today.
Thank you.
We know this now.
Thank you. Thank you for giving me the opportunity.
Thank you for being here with us. And if you would like any additional information on today's topic, just head over to the Hot Links page on WNEM.